In this video, I will explain what the 10T standard is in pregnancy. Before I will introduce, my name is Hanifah Febriani. I'm a midwifery student at the Ministry of Health Riau Health Polytechnic. And special thanks to Mr. Afrianto Daud as my lecturer English. Okay, now let me see my explanation. What are 10T standard antenatal care? Antenatal care is a health term that refers to a program of health service for pregnant women by professionals. Each antenatal care program has been adjusted to the standards set in the guidelines for hospital staff and local health centers. In antenatal care in Indonesia, the term Formula 10T is known. The term appeared in the press release of the Ministry of Health of the Republic Indonesia in 2009. What are summaries in the 10T? Let's us consider the following explanation.
1. Weigh the body weight and measure height. The purpose of this measurement is to monitor the development of the body of a pregnant woman. The doctor will record any change that exists to determine whether moms have a risk of pregnancy. For example, pregnancy with obesity or twin pregnancy or more. 2. Check blood pressure. Just like measuring weight and height, blood pressure checks are a must for obstetricians during antenatal care. In fact, routine blood pressure measurements are done every antenatal examination. Normal blood pressure reading result in the numbers 110, 80 to 140, 90 mmHg. 3. Check the head of the uterine fundus, or top of the uterus. The size of the uterine crest is considered normal if it is in accordance with the uterine fundus size chart with a tolerance of 1 to 2 cm difference in size. If uterine crest measurements show difference of less than 2 cm from gestational age, the risk of fetal growth disturbance increases. 4. Screening for tetanus immunization and tetanus toxoid immunization or TT. The purpose of screening is to determine the dose and immunization status of tetanus toxoid that has been obtained previously. Tetanus toxoid immunization is quite effective if done at least twice with a gap between immunizations of 4 weeks. 5. During iron tablets. Health workers will prescribe iron for pregnant women to consume every day during pregnancy. Do not consume this iron tablet along with coffee or tea because it can interfere with the absorption of iron into the body. 6. Set the nutritional status. To detect malnutrition during pregnancy early, a way to measure nutritional status is to measure the circumference of the upper arm and the distance of the shoulder based to the tip of the elbow using a measuring tape. 7. Laboratory tests. During the antenatal examination, The doctor will take samples from the body of moms for the purpose of laboratory tests, both routine and special tests. The laboratory examination includes at least blood and research examination, examination of hemoglobin levels, tests for HIV and other sexually transmitted diseases, and rapid tests for malaria. 8. Determine fetal presentation and fetal heart rate. The purpose of fetal examination and fetal heart rate is to monitor, detect, and avoid risk factors for prenatal death caused by infection, growth disorders, congenital defects, and hypoxia. 9. Case management. When undergoing antenatal care, moms are entitled to adequate health facilities. If the test results show that mom's pregnancy is at high risk, the hospital will offer to moms to get the case management immediately. 10. Meetings for referral preparation. This dialogue can help pregnant women determine pregnancy planning, prevention of pregnancy complications, and delivery. Intermediate meeting services are also needed to agree on birth plans, referrals if necessary, guidance for parenting, and use of postpartum birth control.
Okay guys, thanks to all of you who have watched my video. See you later!